All right, good evening, everyone. Thank you for coming. This is part one of 3 of the fabulous information you're going to learn tonight about retirement. My name's Rochelle Haiti. I'm here from the Madison School District Benefits Department, and for the next hour or so, you're going to learn more about Medicare, and that is through Virginia Van Haren. So we're going to hand it over to her for a little bit. Hold your questions until the end if that's okay, and then we'll hang around a little bit to answer your questions after this and after the next 2 parts as well.
Okay. Hi, everybody. Thank you for coming. Can you hear me okay? Okay, awesome. So again, I'm Virginia Van Haren. I work for M3 Insurance. I am an individual who works with people who need help navigating Medicare. I do not work for Medicare and I don't represent Medicare. I do represent individuals such as yourself who need help finding different plans, different options, discussing when you should enroll based on whether you're going to continue to work or not. So tonight we're going to go through Medicare Basics 101. I look at this as a learning experience, whether you've already been to one of these presentations or you've been and met with someone about Medicare. There's always really good information when it comes to Medicare. And if you're contemplating retirement, this is something to think about when you want to start Medicare versus continuing to work at age 65. So we're going to go through information today. The topics we're going to talk about are what the different parts mean. We're going to talk about what it covers and what it costs. We'll talk about when you're eligible to sign up for coverage. When you become eligible, how do you enroll? There's a couple of different ways that you can enroll. What other medical insurance will you need besides Medicare? Because Medicare does not cover everything. A lot of people aren't aware of that. Medicare does not cover all your expenses. And then the type of insurance that you can buy to help pick up those costs, which is Medigap and Medicare Advantage plans. There are 4 basic parts of Medicare. Now, you have a whole alphabet when you look at Medicare. If you go onto Medicare.gov, you'll have a whole alphabet of letters. But if you as an individual could wrap your head around the 4 basic parts of Medicare, you will find it much easier to navigate. You know, sometimes there's a lot of information that you need to know as an individual, but what makes it easier for you to understand Medicare are these 4 basic parts, okay? So that's really what we're gonna go through today. Medicare Part A is your hospitalization. Medicare Part B are your physician services. Medicare Part C are what we call Advantage plans, and that is really just health insurance that you buy, okay? Part C are Advantage plans, and Part D are prescription drug plans. So that's what we're going to talk about today. I'm going to talk about how they work, I'm going to talk about how they pay, and we're going to talk about the different options and how much they cost. So Medicare Part A is paid based on a benefit period, and I'm sure you probably heard of this maybe from someone that you know that's on Medicare. A benefit period is really a number of days that Medicare decides to pay a portion of the cost. I use it and call it a deductible. So a benefit period begins on the day that you're admitted in the hospital and ends when you've been out of the hospital for 60 days in a row. Very confusing. It's not something any of us keep track of. We're not looking at counting the number of days that we've been hospitalized. But why it's important to you is that you could have more than one deductible per year, depending on the number of time that you're hospitalized. So on the graph up here, it's going to show that Part A pays based on the number of times that you're hospitalized. So if you were to have a hip replacement and you were hospitalized, Medicare would pay everything but $1,340. And these are 2018 numbers, so those numbers will change in 2019. If you were to go back in the hospital 30 days later because you got pneumonia or got sick, you would not have to pay the $1,340 over again. But if 90 days later you got ill, you would have to pay the $1,340 again because you were in another benefit period, right? Confusing. It's not like a standard deductible where it starts January 1, you pay the deductible, and then you start paying coinsurance. This is based on the number of times that you're hospitalized. So your room and board, your general nursing, your lab work, MRIs, CAT scans, anything that you have done in the hospital except for your physician's charges because your doctor, anesthesiologist, surgeon, anybody in the hospital is covered under Part B if they are a physician. So Part A is just your general nursing, room and board, anything with lab work, x-rays, CAT scans, MRIs, that's all Part A. But why it's important to note is that Medicare does not cover everything, and you could have more than one deductible on an annual basis. Okay? So I always tell people when you're thinking about Medicare, make sure you have other insurance to help pick up those costs. Because when you look at the graph and you look at from days 61 to 90, you would pay the $1,340 again as a deductible, but then you'd pay $335 a day, including the $1,340 for that benefit period. Now, none of us keep track of the days. I didn't keep track when I was hospitalized and then got out. I don't count the 30 days, the 60 days. Why it's important is that you have other insurance to help pick up those costs, because none of us are going to keep track and count those days. We're not aware of that, right? You don't think about those things when you have to have another hospitalization. But if you have other insurance to help pick up those costs, you do not run into those types of out-of-pockets. There's no cost for Part A if you or your spouse have worked the 40 quarters of Medicare-covered employment. So even if one of you did not work, say one of you stayed home and one of you worked, as long as one of you worked the 40 quarters, there is no cost for Part A. So that is premium free. We don't pay for Part A. If you did not work the 40 quarters, you would then touch base with Social Security office and Medicare to find out what that cost would be.
What do you mean by 40 quarters? What is that?
Well, 40 quarters would be full-time employment. So 40 quarters, right? A quarter is part of the year, for the year. 40 of those quarters is considered Medicare eligible premium free Part A. So 10 years. 10 years of full-time employment would give you premium free Part A. So if you did 30 quarters, the first 10 years, and then later went back to work and did, another 10 quarters or whatever it was that you did it, as long as it was 40 quarters total prior to turning 65, it would be premium free. Does that make sense? And they'll let you know. So as soon as you sign up for Medicare, they're going to let you know what that cost would be, okay? So if there's a cost for you based on not working the number of quarters, then they would let you know what that cost would be for that. Okay, eligibility starts the first day of the month that you turn 65. If your birthday is November 15th, you are eligible November 1st. It is always the first day of the month that you turn 65. It's never the 3rd, it's never the 5th, it's always the first day of the month. So you're eligible at that time. If you are collecting Social Security benefits, so if you decided to draw your Social Security benefits prior to age 65, even if you were continuing to work, they are automatically going to send a card to you in the mail. They're going to sign you up for Part A and Part B automatically. So you don't have to call to sign up. You don't have to go on any website to sign up or go to the Social Security office. They will send you a card in the mail. Now that card usually arrives between 2 to 3 months prior to the month of your birthday. So again, if your birthday's in November, 2 to 3 months prior to that date, you will probably be getting a card in the mail. If you are not collecting Social Security, you would either sign up online or contact your local Social Security office by phone to make an appointment, or you can actually stop in to your local Social Security office. And they have where you take a number, like at the DMV, you just take a number and then they'll call your number. And some days are busier than others. It just kind of depends on where you live, right? And what time of the day it is. They have specific hours that they're open, so you want to make sure you're checking those hours. You can have long wait times on the phone. So the easiest way to sign up is online. It takes about 15 minutes to sign up. And that web address, which is on the last page under resources, is www.socialsecurity.gov. It's on the last page under resources. It's about 15 minutes to sign up online. Sorry? How soon can you sign up for Social Security? You can do that, I believe, at 62. But you're talking Medicare or Social Security? So you would have to contact them on Social Security. I don't work in Social Security, but you can do it during certain times and certain ages, but you would contact them directly. So Medicare Part B is your physician services, inpatient and outpatient. Okay, so think about when you go to the doctor and go to the clinic because you're sick. When you are hospitalized and the doctor comes and sees you in the hospital. The surgeon who did your surgery or the anesthesiologist in the surgery room. These are all covered under Part B, okay? Even if it's inpatient hospitalization, your physician's charges are under Part B. A lot of people get that confused, but you want to make sure if you need Part B to cover your physician's services that you've signed up for it. It covers outpatient medical services and supplies. So think of CPAP machines, right? Think of diabetic equipment. All of that's covered under Part B. That would be picked up under Part B as long as it's not a prescription drug. That's under Part B. Outpatient physical, occupational, speech therapies, preventative cares, colonoscopies, mammograms. When you go to have your preventative exam done, your wellness exam, that's done under Part B as in boy. Your ambulance services, any type of chiropractic care, and then outpatient mental health care. Okay, so think about outpatient services and then inpatient physician's charges, all under Part B. Your Part B works a little different because this works on an annual deductible. So it doesn't work on a benefit period like Part A is. It works on an annual deductible. And for 2018, the annual deductible, which starts January 1 and ends on December 31st, is $183. So you pay the $183, and after you've paid that, Medicare then pays 80% of your cost. So all of your claims that come after the $183 for your doctor bills, Medicare pays 80% of those costs. You would be responsible for 20%. What I want you to be aware of in this situation is remember your physician's charges are under Part B, not under Part A. So if you have a hip surgery and your orthopedic surgeon charges $10,000 for that hip surgery, and Medicare pays 80%, you are responsible for the 20% of that balance. Again, this graph shows you how Medicare pays. What I want you to be aware of is that Medicare does not cover everything, that you will have responsibilities in your cost. So making sure you have other insurance to help pick up those costs is very important, because you could end up with high out-of-pocket costs with 20% of those surgeon's charges, or 20% of an MRI, or 20% of a CAT scan. Those become real numbers, real dollars after retirement, right? We're not making the same amount of money. We're making a certain amount of money, and we want to be able to afford health insurance, but we also don't want to end up stuck with a ton of out-of-pocket bills. So always think about what those costs could end up to be. So when you're thinking about Part B, think about the 20% that you might have to pay in. The cost for Part B for 2018 is $134 per month per person, okay? So Part A, there was no cost. Part B, there is a cost. Now, if you're receiving Social Security, they will pull it right off the top of your check. They're not going to ask you, they're just going to take it right off the top. It's the easiest way for them to administer it, so they pull the $134 right off the top of the check. If you are not collecting Social Security because you delayed based on the timing you wanted to enroll, they will then bill you quarterly. So they'll send you a bill for 3 months. You must pay the 3 months premium at one time. And the $134 is per person. So if you're married, each of you pay $134 per person. And that's just for Part B. That does not include prescription drugs, does not include Advantage, supplement, or anything else. That's just Part B. If you make an income of more than $85,000 single, you're filing on your joint or single tax return, or $170,000 on your joint tax return based on your modified adjusted gross income, you will pay more for Part B. So high income earners pay more money for Part B, and the only way to find out what that cost will be is to contact the Social Security office. But that number is important because it goes up based on $50 increments. So if you are a high income earner at $200,000 a year, for both of you, let's say joint, right? You could be paying as much as $250 per person for Part B. So that changes your retirement monies, right? If you're looking at income at retirement, $134 versus $250 is a big difference in cost. And again, that's per person. So you want to make sure you know what that number is based on your income. And the Social Security office will let you know what your cost will be when you sign up. But you can also call ahead of time and ask them, and you can also do it online. If you go online to socialsecurity.gov and you want to look at what that benefit is or what that number would be, you can actually go in there and look it up online. It's pretty simple. But if you really want to talk to someone, you would just give them a call. Your eligibility for Part B starts on the first day of the month that you turn 65. It starts the same time as it does for Part A. So you have the option of signing up for Part B or not, because since there's a cost for that, Medicare allows you to turn it down. So people always say to me, why would anyone turn down Part B? Well, if I'm working, right, I'm still continuing to work, and I'm working for the district because it's a large group employer, my employment, my coverage through my employer is always going to pay as a primary. Medicare would only pick up as a secondary. So people that continue to work can delay Part B without penalties. Since there's a cost, you have the right to turn it down. So I always tell my clients 3 months prior to turning 65, because we all know when that date's coming. It's like when you turn 50, you're like, I'm going to be turning 50 in a few months. When you turn 65, you know the date's coming. So you always want to think, what should I be doing? Even if you're going to continue to work, ask the question, should I be signing up for Part A and should I be signing up for Part B? If I delay it, will I be penalized? How much is it going to cost me? If I sign up for Part B, what other insurance do I need? So I use the rule 3 months prior. You'll hear that out of me a lot tonight. I'm going to say 3 months prior to turning 65 or 3 months prior to leaving your job. Make sure you're checking into what you should be doing. Because if you miss signing up when you're first eligible, you can have penalties at a later date. Okay? And those penalties can last forever. So you want to make sure you're signing up when you're supposed to be. So 3 months prior, ask the question, do I need to sign up for Part A and Part B? If I delay Part B, will I be penalized? And do I need any other health insurance along with Part A and Part B? Okay, so it's pretty simple. If you can just think about it a little bit prior, then it will help you be able to form that decision of what you need to sign up for. So again, if you're collecting Social Security, they're going to enroll you online automatically, so you don't have to do anything at that time. If you're not collecting Social Security, you will want to sign up via the Social Security office or the website. You can call or you can stop into your local Social Security office to get signed up. Now, if you are working for a large group employer, such as the school district, and you want to turn down your Part B because you're continuing to work, you have a right to do that without penalty. You will not be penalized as long as you or your spouse continue to work for this employer. Once you leave your job, you will have an 8-month window to sign up for Part B without penalty. So again, the decision goes back to, are you going to continue to work? Are you considered an active employee? And should you be signing up for Part A and/or Part B? Medicare says it's actually Part B is voluntary, so you have a couple times when you can sign up. The initial enrollment period is a 7-month period that begins 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. Totally confusing. They give you 7 months, 3 months before, the month of, 3 months after. It's totally confusing on when you should sign up. When do you want your Part B to start? If you want your Part B to start on the month of your birthday at 65, you should sign up 3 months prior to your 65th birthday. So again, I go back to the 3-month rule. Medicare gives you 7 months, but if you want it to start after your 65th birthday, you would then delay it. So it's all about when you want it to start. But most people who sign up for Part B either want it to start on their 65th birthday or when they leave their insurance through their employer, right? When you leave your group plan. So it's important to make sure you're signing up when you're eligible. Your general enrollment period would be for someone who did not sign up at the time they should have for Part B. And that's basically every year from January 1st to March 31st, but your coverage will not begin until July. So people that miss signing up when they're eligible would want coverage to begin January 1 if possible, right? Medicare says they will delay you until July 1st of that year. So you've got a 6-month waiting period before coverage for Part B will begin. So please do not miss when you're supposed to be signing up for Part B because you will have delays. So all of these enrollment periods are very important because if you miss them, you have to wait to sign up for coverage. And if you need insurance because you're sick, you may not have any bills being paid for under Part B if you didn't sign up when eligible. So you want to make sure you're signing up when you're supposed to.
So if you are over 65
Mhm.
and you work and you decide you're gonna retire February 1, when would you want to?
3 months prior to February 1st.
3 months.
3 months prior to February 1st. The question was, if you're older than 65 and you continued to work and you decided to retire in February, when should you sign up for Part B? And my answer is 3 months prior to your retirement. If you know when you're going to retire, 3 months prior, that gives you adequate time to get signed up for Part A, Part B, and then other insurance and prescription drugs. This way you have your cards in hand, right, prior to retirement. You have everything ready to go, and you don't have to worry about having insurance that first day after you come off your employer plan. Yes?
So 3 months prior applies regardless of which month?
Well, I use 3 months because, yes, it makes you work ahead of time so that you have everything in place with the month that you need it. That's just my rule. It is not Medicare's rule. By no means. It's not Medicare's rule. It's my rule. Because working with clients, we procrastinate. I'm sorry to tell you. We procrastinate. It just is what it is. I had someone call me today and said, my birthday was yesterday. I turned 65. What do I do? Well, you have a couple of options. But if you use the 3-month rule, you will have adequate time to make that decision, and then you're not rushing because you already have a lot of things that you're thinking about, right? My income, did I get everything in place at retirement? Do I have this closed out at the bank? You know, EFT, and all of those things are coming to play. And this should be the least of your worries. And if you get it done prior, I promise it'll make retirement much easier and you don't have to worry about it. So 3-month rule, yes.
So the prior slide you had up there.
This one?
Yeah, so that general enrollment period, that's, so if you're gonna retire, say, at the end of the school year, and your coverage is gonna stop in July.
That would not apply to you. This would be, the general enrollment period would be for somebody who just didn't enroll in Part B. So it wouldn't be for anyone who's employed. So consider this for someone, I'll give you for instance. Gentleman just doesn't want to pay for Part B because it's $134 a month. And I've had clients that do this. I'm healthy, I just need hospitalization because they feel like that costs more. So I just don't want to pay the $134. I'll sign up when I get sick and when I need it. That's what the general enrollment really is for, or if you were to miss your date. But as an employee, if you wanted to retire, you actually have an 8-month window to do so. But I would say 3 months prior is the best bet to go with. So you would not have to wait until January or July. Yes.
So, in my situation, I'm already collecting Social Security.
Okay.
I do not work in the school system, but my wife does.
Okay.
She's going to retire in April.
Okay.
I am signed up now for Part A.
Okay.
Mm-hmm. I declined Part B.
Yep.
When would I notify Social Security?
3 months prior to April.
3 months?
3 months prior to April. All you have to do is there's a couple of forms that you complete, you submit them in, they're going to send you a new card with your Part B in. 3 months prior to retirement. If you know, get signed up for Part A, Part B.
So would my Part B start?
Your Part B will start on whatever, if it's April 1 you want, you write on the thing, on the paper, I want it to start April 1. You tell them when you want it to start. But 3 months prior will give you adequate time to do that. Okay? All right. These are your new Medicare cards, just in case you haven't seen them. Everyone should have got a new card in July. Medicare sent out all new cards. They finally stopped putting our Social Security numbers on our cards, thank heavens. So your new card will look like this. It will always say Part A and Part B will start the month of either your 65th birthday, or your Part B would start the month that you enroll, right? If I wanted to start 1/1 of 2019, when I get it, it's going to start 1/1 of 2019. But it's always the first of the month. It's never the 3rd or the 5th. It's always the 1st. Your special enrollment period, this is for anybody who's actively working and wants to leave their employment and their employer coverage. It gives you an 8-month window from the time that your employer coverage ends. So whether you retire, quit your job, you get ill, you have to leave work, your job's no longer available, your employer no longer offers coverage, you have 8 months to sign up for Part B without penalty. 8 months. However, I'm going to go back to my 3-month rule. If you know you're going to retire 3 months prior to retirement, get signed up. Now, sometimes we don't know we're not going to have a job anymore, or sometimes we don't know we're going to get sick and not be able to come back to work, or sometimes situation happens where it just happens and you don't, you have no clue, you don't have 3 months, you have tomorrow, and that's what you have. As long as you're getting signed up as soon as possible, you could have that coverage start when you wanted to. So, 3 months if you don't know, as soon as you're able to contact Social Security office so you can make sure that Medicare gets started for you, okay? Because I know there are situations that you didn't have 3 months prior, but this is just to let you know you do have an 8-month window to sign up without penalties. But you wouldn't want to wait 8 months, right, if you're not going to be at work tomorrow. I wouldn't want to wait 8 months to sign up because I'm not going to have coverage for 8 months. So I'm going to immediately sign up as soon as I can once I'm no longer actively employed. Does that make sense? Okay, so as soon as possible or 3 months prior. COBRA, if you elect COBRA, here's another thing that people aren't aware of. If you elect COBRA, it means you are not an active employee. It means you're no longer working at the school district. You are paying the full premium that the school district has paid for you. You have to have Part A and Part B if you sign up for COBRA. You have to have Part A and Part B if you sign up for COBRA, because Medicare becomes primary for you at that time because you're no longer an active employee. Now, the other thing to remember is COBRA, again, is a high premium because it's 100% of what your employer has paid for you. So what the school district has paid, no discounts, it's 100% of the cost of the plan that you have. If Medicare is paying primary for you and you have COBRA, you are paying too much money. You can get a supplemental plan, an Advantage plan to pick up costs much, much, much cheaper than what you'll be paying for your COBRA. Okay, so make sure you talk to somebody about what plans are available. If you have to elect COBRA for a month, you can come off your COBRA and get onto other Medicare supplemental and prescription drug plans to help alleviate these costs. but you have to have Part A and Part B. And a lot of people don't think that. They think, well, I'm still on my employer's plan, so I'm still being covered the same way I was. Inaccurate. Medicare will pay primary, so you need to have Part A and Part B. If you're 65, this is only for Medicare eligible. Again, all of this is only for Medicare eligible. If you're under 65, this does not apply to you unless you have disabilities and are on Medicare, okay? But this is just for going forward, because a lot of people will say, they'll delay and then they'll get a letter in the mail and say, well, I'm just going to sign up for COBRA so that I don't have to worry about, not having insurance. And the problem with that is you still have to have Medicare Part A and Part B. So that's really why I go over that and over that and over that, because a lot of people will just take the COBRA, sign it, send it back to the district, and then you're sitting on a COBRA plan without the proper insurance. So it's just to make sure you're aware. Okay. So that was really Part A and Part B. Another thing to note, with Medicare Part A and Part B, those are the only two that you can sign up for at the Social Security office. Okay? You cannot sign up for Part D prescription drug plans there. You cannot sign up for supplemental plans there. And you cannot sign up for Part C Advantage plans there. You can't sign up for Part M, Part N, Part L, none of that. The only things you can sign up for at the Social Security office are Part A and Part B. The rest of the plans and all of the information that you're going to start getting in the mail, right? You're going to get stuff every day about what plans are available. You would sign up either directly through the carrier, or you would work with an agent to help you get signed up. You can also work with ADRC, which is Aging Disability Resource Center. So there's a lot of resources available, but you would sign up for that on your own or work with someone to do that. Medicare is not going to help you sign up for any of that. A lot of people think when they go to the Social Security office, they're going to get signed up for everything. So I just want to make sure that you're aware. It's just A and B. Okay, so now I'm going to skip to Part D, which are your drug plans. I want to review the 2018 information for Part D. Part D on the prescription drug side is where most people will spend the most out of pocket, depending on the medications that you're on. Part D prescription drug plans are sold by carriers such as Humana, AARP, United Healthcare, Cigna. There are tons of them that are available. They are built by the drug plan. However, they have to follow the guidelines of what Medicare tells them based on the year. So, to be a little more confusing, the guidelines have to be followed by each carrier exactly the same way. However, the copays and the deductibles can be a little different. So it gets kind of confusing when you're looking at drug plans, because this is where people, if they are on high cost medications, will spend the most out of their pocket. So for 2018, Medicare says they cannot charge you more than a $405 deductible. So the plan cannot have more than a $405 deductible, but a plan could have a $0 deductible. Or a plan could have a $20 deductible or $200 deductible, but it can't be more than $405 in deductible. So once you've paid the $405 in deductible, you as the enrollee will then pay your copayment, which is a dollar amount, right? You pay a copayment when you pick up your drugs now. It's a dollar amount. And the copayment will depend on the drug, whether it's a generic or a brand or a non-formulary. Or a co-insurance, which is a percentage of the cost of the medication. So that's a percentage amount, so it could be 20%, 30%, depends on the tier, again, that it falls in, until the total charges that you have spent and that the carrier has spent for the cost of the drugs reach $3,750. Now, $3,750 is where the donut hole starts, okay? That's where then you, as an individual, will pay a percentage for generics and a percentage for brand name until you reach a total of $5,000 out of pocket. That's called the donut hole. Once you've reached $5,000 out of your pocket, Medicare then starts pitching in, and you would pay 5% of the cost. So, if you are an individual who is on I'll give you just like a generic high blood pressure medication or a generic cholesterol medication, and let's say a generic antidepressant, you're never going to hit that $3,750 because your drugs are going to be generic and they're really cheap, okay? But if you are someone who's a diabetic or you are someone who has a chronic condition, heart disease, fibromyalgia, MS, you could run into the $3,750 and then run into the $5,000 out of pocket. So what you want to make sure on your drug plans are that you're working with your physician to make sure you have generics available. You are working with your physician to make sure you are on the cheapest drug that you can take so that your out-of-pocket costs are lowered. And then you're working with whomever sets you up on a plan, whether it be the carrier or the agent that you work with, that you have options of looking into coupons and things like that. Because that $5,000 out of pocket for 2019, it actually is going to go up. So that $5,000 out of pocket is your responsibility. That's what you would pay from January 1 to December 31st of 2019. And I don't know about you, but $5,000, right? I mean, a year is a lot of money. So you need to know your medications. You need to start taking control of what it is that you need and make sure that you're thinking about what those costs might be. Because this is where people spend the most money, especially on new drugs that come out too. So the other thing to think about, if it's a brand new drug and it comes out, Medicare doesn't have to cover anything until you reach that $5,000. It's you and the plan that you're working with. So if they don't cover the drug, then you could be paying the out-of-pocket costs. This is what the graph looks like. It helps explain it a little better. On the bottom, you're going to see the deductible. Then you're going to see where you and the insurance carrier that you pick pay a percentage. You pay 25%, they pay 75%. Until you hit $3,750. Then the donut hole starts. This is where you as an individual are going to pay a percentage for generics and brand names. And then you can see Medicare finally starts chipping in after you've hit the $5,000, and then they start paying 80% for the cost of the drugs. So if your drug's $700, right, and you're paying 40% of that cost, that's a huge amount of money until you reach a $5,000 catastrophic amount of money. So you want to make sure you know your medications, that you're on generics if available. This is the most costly part of Medicare. Yes?
Why would a generic drug cost more, a percentage paid more by the participant?
Because generic drugs are cheap, so $10, if you had to pay 44% of $10, it's only $4.40, right? But if you're paying 30-some% for a $700 drug, so they try to lower the percentage on the brand names, but it's really costly when it comes to that donut hole area. And those numbers will change next year. Now, by 2020, the donut hole is supposed to be closed. So what we're being told by the government is they're eliminating that cost from the $3,750 to the $5,000. That's supposed to be closed. What we're being told right now is that it's going to be an 80-20 guideline. Medicare pays 80%, you would pay the 20%. So I haven't seen anything in copy yet to see what that's exactly going to look like, but I am excited to be able to help eliminate those costs because, again, that's where a lot of people with high-cost medications will pay the most out of pocket. Yes?
What would be changed to 80?
The drug plans. So instead of that, where you see that $3,750 to the $5,000, that's the donut hole. That's where you will pay more money out of pocket. Medicare is looking at changing that to an 80% Medicare pays and 20% you would pay.
So would there still be that $5,000?
No, I don't believe we're going to have the $5,000.
It wouldn't be the $3,700 or the
Correct.
$5,000.
Correct. Correct. Just 80%, 20%. Well, there might be the deductible still. So each plan, they could still put in a deductible. More than likely they will. More than likely they're going to charge more in premiums because 80-20, to be honest with you, I don't see Medicare covering that much of the cost because the drugs are very, very expensive. So at some point we're either going to be paying more in premiums or we might have higher deductibles. But I think it's going to be 80-20 straight across the board. At least that's what we're hearing. So hopefully that will be released to us sometime early 2019 so we can make adjustments for our clients, right? To see what those costs would look like. Yes?
Is the donut hole, is that $5,000 in addition to the $3,750?
Nope, it's $3,750 for you and the individual. You need to get to $5,000. So whatever it is that you've paid in the $3,750 plus whatever it costs you to get to $5,000. So that's you as an individual.
So for a couple, you're talking 10,000.
Correct, if you have high-cost medications. Now, again, if you don't have high-cost medications and you're on generics, you're never going to get there. You're going to be paying like $5 to pick up your medications. This is just so people are aware that are on high-cost medications, because even if you look at Abilify, let's just use Abilify, for instance. It's a antidepressant. That drug is about probably $400 to $500 out of pocket, the average cost, not what you pay, because your insurance company is paying a portion of that, right? A lot of people pick it up, it's like $30, $50. The actual cost is like $450 to $500. So when you think about a generic form, Abilify is not generic, it's a brand name, but if you look at a generic form of that, the cost is probably $50 and you're probably paying $5. So it doesn't cost the insurance company as much. So that's the reason why you're doing that percentage where they're saying during this time frame, you're going to pay more out of pocket for that cost because it's expensive.
So you have low drug costs.
Mhm.
And on February 1st, you get sick.
Yeah.
So,
Yeah, that's a tough call. So you have low drug costs, and then in February you get sick and you get put on high medications, right? You're just paying whatever those copays are on the plan that you're on. Yep. You don't know, none of us know. I don't know on my plan if I get sick tomorrow, I don't know that I'm going to be paying 50% on a drug. It's the same kind of what you have, you just don't know. The problem is you would be paying more costs depending if you hit the donut hole or not. Yeah. And that's why I mean it's a tough call, right? It's kind of confusing on what plan to go with, and if you're going to run into that, what is that going to look like based on your out-of-pocket and what you can afford? So those stories are real. When you hear about people not being able to buy medications, the stories are real. There are people that can't afford medications because they can't afford the donut hole and pay those out-of-pocket costs. Did you have a question over here? I'm sorry, I missed you.
So is that 405, is that a deductible or a premium?
That is a deductible.
So you don't have to pay that?
You would pay it depends on the plan. If you had a deductible, you would pay the deductible first, and then
If you're on a med. But
if you're on a med, if you're not on any medications, you just pay the premium. Yep, you would just pay the premium for the plan. There's a premium for the plan, so if you buy a plan from Humana, it's $20 a month every month. If you are not on any medications, you'd never pay the $405 deductible. But if you got 3 medications, you'd have to pay the $405 first, and then the plan starts paying. Okay? So,
all private insurance companies have to follow this guideline?
yes, they have to follow the guideline. Every one of them have a donut hole. Every one of them have they don't have to have a $405 deductible. They can have no deductible, but they can't charge more than $405. But the $3,750, the $5,000, and the 5% all stay. Every carrier has to offer it that way under Part D. Yep.
But the premiums, you elect
Premiums are different.
or
Premiums are different.
pay more premium, you probably can get these costs down.
Lower deductibles. So you can get a lower deductible. You can't change that $5,000 though. You can't change any of that. So the higher the premium in a plan could be the lower the deductible. So they could lower the deductible to 0. They also might have a larger formulary. A formulary is a list of drugs that they cover, right? Some carriers cover some drugs, some carriers don't. You can find plans that you're on this year and you go to sign up next year and they don't cover your medication. So you need to make sure your drugs are on the formulary. Each plan changes. Each year they have an opportunity to switch those policies. Yes?
And I understand if you don't apply, if you don't sign up for a Part D, and then you want one later, there's also a penalty.
There is a penalty. So
So it's better to sign up for a little plan D, because you can always change it every year.
So if you're on no medications and I was looking and working with you as a client, I would sign you up in a plan that had a very minimal premium but still had decent coverage. Because let's say you got sick and I didn't have you on a good enough plan, I would have an issue with that. But if you didn't have medications, I would not be looking at a plan that was $100 a month, right? I would be looking at a plan that was $20 a month. Absolutely. You can switch your plans every year, and that's what we're in right now is open enrollment. This is from October 15th through December 7th. And when I work with my clients, we look at their drugs on an annual basis. So we want to make sure you're on the right plan from year to year. And you should be doing that as well, no matter who you're working with. Make sure you're looking at your medications and see if they're on your plan for the following year, or if you can find a plan that's cheaper. Because each plan has different copays, different pharmacies, different deductibles. I mean, all of that comes into play. You could have a $3 copay on one plan and a $7 copay on another plan, same drug. Pharmacies are different. I mean, it's all based on where you live, the networks, it all comes into play. So you want to make sure you have the accurate plan for the drugs that you're currently on. And you and your spouse might have two separate policies because you don't take the same meds as your spouse does, probably, right? So I wouldn't put you on both the same plan unless it made sense based on the out-of-pocket. Oh, gosh, sorry. Okay, so open enrollment, you're eligible when you sign up for Part B as in boy, okay? So you want to make sure you're looking at those plans. Medigap plans, real quick. Medigap plans are Medicare supplement plans. They pick up what Medicare doesn't cover. So remember on Part A and Part B when I showed you those graphs where you had the $1,340 and then every day you were hospitalized, you might pay a cost per day. And then on Part B where I showed you that 80-20, Medicare didn't cover the 20%. These policies pick up the gaps. They have no deductibles, no copays, and no out-of-pockets. Medicare pays its portion, sends the rest to the supplement plan. The supplement picks up the balance. These policies are some of the best policies you can buy. You can go to any doctor in the country that accepts Medicare as long as they say Medicare supplemental plan. You have access to any clinic, any hospital, as long as they accept Medicare. These are the best policies when it comes to coverage. They are the most expensive policies when they come to cost. So when you're considering signing up for a policy, if you want a plan where you're not worrying about network, you're not worrying about out-of-pocket costs on the medical side, you want to sign up because you can go wherever you want to go to, these are the policies to pick, okay?
Can you give an example of what one of those policies costs?
I'm going to give one right at the end here.
Is that what would fall under Part C, the Advantage plan?
No, that's a supplement plan. Part C is Advantage, and I'm going to talk about that here in a second. So, your guaranteed right to buy a Medigap supplement policy is in your Medigap open enrollment. This is another date you have to remember. When you sign up for Part B, you have to decide whether you want a supplemental plan or an Advantage plan. You have a 6-month window from the time you sign up for Part B to have guarantee issue. Guarantee issue means they don't have to ask you medical questions. If you wait after 6 months to sign up for a supplement plan, they can ask you medical questions and deny you coverage. Another date to remember. So 3 months prior to your 65th birthday, what are you going to do? Do I want Part A? Do I want Part B? If I sign up for Part B, I need to sign up for supplemental, Advantage, and then a prescription drug plan. Which one of those do you want to sign up for? And you have to make those choices at that time because if you delay, they can then ask medical questions. So you don't want to delay. Medicare Part...
When you said last for 6 months?
Yes, from the time you sign up for Part B as in boy, you have a 6-month window to sign up for a Medigap supplement plan. If you go 6 months and 1 day, they can say, sorry, we're not going to offer you coverage. Okay, so Medicare Part C, which are called Advantage plans, these are health insurance policies that you buy through a carrier. These are made specific to what the insurance coverage wants, or the insurance carrier wants to offer for coverage. These policies are no longer Part A and Part B are picking up any of your out-of-pocket cost. It is being picked up, all the claims are being paid by the policy. So this is a true insurance policy that you buy from the carrier. So these types of policies have copays, they have deductibles, they have out-of-pocket costs, they have different things that can be added to them to be based on what it is as you as an individual would be looking for. They have a network of doctors. They have a network of hospitals, clinics. You must buy a plan where you live. So these are just the opposite of what a supplemental plan. A supplemental plan pays Part A. After Part A and Part B pay, an Advantage plan pays based on the plan. So if you go to the doctor and your plan has a copay 30, you pay the copay 30. If you are hospitalized and you have a $3,000 deductible, you pay the $3,000 deductible. So Medicare is no longer paying any of your claims. It's being paid by the insurance company that you picked the plan from.
That doesn't sound like much of an advantage.
Huh? Oh, it doesn't sound like much of an advantage. So these are much lower in premiums, much lower in premiums. These are for individuals who like to help contribute to the cost of their health insurance, right? I'm very healthy. I want to look at this policy. I feel like I want to pay a lower premium. I haven't been hospitalized forever, so why should I pay so much more in premium to have this type of coverage? That's really people who look at these are looking at those reasons for. They're not bad plans. They're plans you can switch on an annual basis. They're just plans that have a little more risk because they're not covering everything. Also, network. What doctors you want in your network, right? If you live in Florida, you don't buy a plan in Wisconsin. You can't take the plan with you. If you move, you have to buy a new policy. They come in many different forms. You want to make sure you know what your network is, whether it's an HMO, PPO, point of service, or a fee for service. Check with whomever you're working with when you buy this plan because you may have limited doctors available. You always want to know your physicians are in your network. They may offer additional benefits. Why these plans are really nice is because they can actually include the prescription drug plan that still has to follow the guidelines. It still has the donut hole. It still has deductibles. But you don't have to buy a separate policy, so it might be included. Because these plans are built by the carrier, they can offer things like dental, vision. They can offer acupuncture, massage therapy. So they can add in different options because it's not picking up what Medicare doesn't cover, right? It's a plan that's built specifically by the insurance carrier. So here's the cost between the two. Everybody pays Part B. That does not go away. It depends on what your cost is for Part B. Average Advantage plan is about $50. I will tell you, you can buy one for $0, you can buy one for $20, you can buy one for $30. Average is about $50, depending on where you live. So your whole cost out of pocket, not including copays or deductibles, because remember you'll have copays and deductibles, about $184. If you're looking at supplement, you're looking at the $134 plus about $165. No copays, no deductible, no out-of-pocket cost though. Remember, nothing that you have to pay. And then add in about $50. That's a little high, but about $50 for the Part D plan. That puts you at about $349. Big difference, $184 to $349. So how much can you afford? What type of coverage do you want? When do you need to sign up? And then you need to make a decision on what plan that you want to go with. Here are the resources for you, the numbers, the Social Security. ADRC is also available in every county. They're great to work with. The numbers to Medicare, and then the SHIP, which is State Health Insurance Assistance Program. They're also available in every county in Wisconsin. They're wonderful to work with if you need assistance based on income and Medigap plans. They'll help you with that. Otherwise, I'm over my time limit, so sorry. So questions? Yes?
So Medicare, you don't qualify till you're 65.
Until you're 65 unless you have disability.
Right.
Yep, so 65. This is for anyone 65 or older unless you're disabled. Okay, so my contact sheet is outside on the table or in the packet. It's a blue sheet. It talks about what I do, who I am. It has my telephone number. It also has my email address. If you have questions, wish to work with us, you can always give us a call, ask questions. Even if it's a general question, feel free to give us a call so that we make sure you're making the right decision moving forward. Okay, thank you so much for coming. Have a good evening.
You're welcome.